Hello again, everyone. Mark Macomb, Macomb County Executive. John Paul Ray, our Deputy Executive here for the county. Just giving you our Monday update, what's going on with the coronavirus, as how it's impacting us here in Macomb County specifically. So where are we at with numbers this Monday morning, John Paul?
Mark, over the weekend, we now have a total of 6,400 cases countywide and unfortunately 741 deaths. The good thing is the recoveries are continuing to surge across the county. Over 3,800 certified recoveries using the state statistics on that front. Statewide, 5,100 cases, 4,800 deaths, and again, the concentration here in Southeast Michigan that we're continuing to see. But the good thing is, as the health department has been able to illustrate through the different maps and graphs that we have online, we're seeing some positive trends in not only cases, but also deaths.
You know, that's the interesting thing. I think we keep talking about the numbers, and it's going to continue to rise when we start talking about how many cases total, you know, as far as people that have contracted the coronavirus, how many people have died as a result of this. And tragic where we're at, not only nationally, obviously statewide and even in the county, but as we're looking at the numbers, to stay home, stay sheltered, stay in place, all the stuff that people are doing now, following CDC guidelines, has had an impact. And I think it's going to continue to do that because a lot of people are still concerned. But with that, over the past 10 days, if you think about the numbers, over the past 10 days, the largest number of cases we've had was on the 12th, and there were 37. I mean, that's dramatically lower than what we've had in the past. And even the deaths, May 8th, the largest number we've had over the past 10 days was 6 deaths as a result. Granted, we'd like to see no deaths. And I think the city of Detroit finally recorded a day where they had no deaths. Here in Macomb County, May 14th, we had 1 death that was recorded, and also the past 10 days. And as far as cases, 10 on May 15th. So it's interesting. We have seen a dramatic decrease. We've already made it past that part where people say flatten the curve. How do we, you know, lessen the apex? We have done that, and I think it was a commitment on behalf of the people here in Macomb County, even our businesses. So, you know, the next question is, we're moving into this next phase. Everybody's worried about, you know, this secondary wave or secondary peak. If we continue doing what we're doing, I don't think we're going to have that concern. Do we have to start opening business? Yeah, we've seen that. We've seen the governor already open some businesses. Granted, there's not a lot of lead time that they're getting. As a result of the plan, it's the most difficult thing I'm getting from businesses is when can I open? What are we looking for in those numbers that's going to give me some direction as to knowing when I can open? And I'm going to tell you, it is the most frustrating thing that I'm getting from businesses, that question, because I can't answer it. They're concerned. They're saying, what is it we're basing that decision on? And it's not in the chart. It's not in the plans. I know I get criticized for, I guess, criticizing the governor. I'm not here to criticize the governor. I'm asking a question to give some lead time to these businesses because we've already made it through that first goal. And that was trying to figure out how do we lessen the curve and you know, not have an impact on our hospitals. Hospitals are saying, we're open for patients other than people dealing with corona because we have the capacity and we have the ability to handle that. And I tell you, it's just this morning I got 2 more business people asking me, why can't I just open the county? Why can't I just allow businesses to open here? I can't do that. These are governor's orders. And then when they ask the question, well, when do you think? I can't answer that. I don't know because I am not getting that information coming back my way either. But yes, I believe businesses here in Macomb County, if given the ability to open, will do it in a very responsible way. They will follow the guidelines. They'll follow whether it's a governor's order and or CDC recommendations because they want to be part of the solution as well. We can't continue this lockdown on business as we move forward. You know, we've got to figure that out, and business needs some lead time to know when.
Mark, you talked about the whole notion of other industries already phasing in operations, whether it's construction, real estate a few weeks ago, whether it's manufacturing phasing in last week, and as we stand here today, the big 3 phasing in operations. Everyone's putting in those contingency plans and strategies, whether it's getting PPE, whether it's retrofitting the workplace. Businesses want to be a part of that solution, and again, a lot of these conversations go to the extreme and they want to create friction. All we're looking is for more clarification as we get these executives' orders, as we're working with regulatory agencies, as we're engaging our health departments. It's making informed decisions in the most responsible time frames. And what we're hearing from the businesses is, when is it going to be time? When can we start getting our operations going? That's what we're working with on a day in, day out basis, and we continue to field these calls. But we're also continuing to get in other parameters to get businesses ready, whether it's these businesses care packages that you announced last Fridays, whether it's different things with the CARES Act. These are things we want to get in the queue and get businesses back to work here in the county.
And to your point, they opened up construction.
Yeah.
They opened up the realtors. I mean, they got them back up and running. And the question that we're getting from the people that are owning gyms, hair salons, restaurants, and even people like Barrymore's. Boy, I tell you, you look at their facility, and they're wondering, when do we get to open this up? Even Jimmy John's Field. You got folks that are saying, hey, what did she base that decision on, the governor, to go ahead and allow for construction and the others to open? What was it in the numbers? That's all we want to know, because we think we're meeting that goal as well. And we will do those things that those other construction companies and suppliers are doing, making sure we have protocols in place. We just need to know what it is so we can prepare to open. And that is definitely not an answer I can provide them, and it is extremely frustrating.
Mark, it's interesting because we want to be cautious, but we also need to be calculated. We just can't go to one extreme or the other extreme in everything, and it's that calculated element with working with our private sector counterparts, taking all that information that we're getting from the health department and using that to develop localized solutions for the case of a specific business, for a larger industry, or more importantly for the economic prosperity that we're looking to phase back in here.
It sounds like, we're kind of beating the drum here, and some people will respond by saying, oh no, let the governor continue to lead, and don't question that or whatever. Once she opens, we can't just go back to opening everything up and causing this pandemic to resurge. That's not what anybody's saying. Nobody's saying that. Nobody wants to see a resurgence. Nobody wants to see anybody get contract the virus. Nobody wants to see anybody die. All we're asking for is, what are we basing numbers on that are allowing us to open certain businesses as opposed to others? And the others that are sitting there waiting to open, they're trying to get something more than just all of a sudden here we have a press conference on a Friday being told that Monday you can open. They need some lead time to understand this. And again, that's becoming the most frustrating challenge, and I hear about it every single day from our businesses here in Macomb County. And the hard part is, I don't have an answer for them. And no business here in Macomb County wants to open their doors and create a resurgence of this pandemic. That's not what they're trying to do. They will follow the guidelines, they'll support what's going on with the governor, and we have been working with them, as you just got through saying, John Paul, with the business care packages. What do I mean by that? PPEs, making sure that they're understanding the protocols, and even online, macombgov.org, the business resource. We have a kind of a laid out plan as to some of the things and guidelines they can follow. And my goodness, I'm telling you, some of these companies, what they're doing far exceed any CDC guidelines or a requirement on behalf of the state, because they care, because they don't want to see a resurgence. They just want to get back working.
Mark, we've engaged more than 1,200 businesses through our planning and economic development team as they coordinated with local chambers, as they've been working with the community college, as they've even engaged the ISD to understand what are these environments going to look like when we phase in back operations, and how can we have the necessary equipment that we need, whether it's from a PPE standpoint or from a retrofitting standpoint.
Yeah, because this can't continue. I mean, the economy is going to be an incredible challenge. We got the dual concern right now. It's the health crisis as well as an economic crisis that is coming our way here in the state. So we've got to figure this out. We've got to figure out exactly how do we do it responsibly, but give businesses the lead time, understanding what are those numbers. Okay, you got experts that are trying to give you as much data and information as you can. You get all that data and information. What is it you're basing it on? Is it 5 deaths? Is it 10 deaths? Is it a week long without having a certain amount of cases? Nobody seems to know what the criteria is that kind of is that triggering point to say, okay, we're going to allow these businesses to go back in if and when this occurs. Nobody knows what that if and when is, and if it's just an arbitrary decision, then say that. We're okay with that, but they need to know that, and I think that's the challenge. So I know I'm belaboring this issue, but I'm going to tell you, much like when we first started, there was an interest on behalf of businesses trying to figure out how do they get PPEs? How do our first responders get PPEs in the hospitals? And that was an incredible challenge back then. This has become the #1 challenge that I've been dealing with our business partners here in Macomb County, even our chambers, to try to get them an answer, and I can't do that. Again, I emphasize, everybody is together on the fact that nobody wants to see anybody get hurt, nobody wants to see anybody die. We want to do it in a responsible way, but how are we doing it? And sometimes people say, well, you don't care about the health part if you're trying to help businesses figure out when to get back in. That is not the issue here. The issue is they're ready to go back, they'll work within guidelines, if and when they know when they can go. So
absolutely, Mark.
Simplest way of putting it. And we got some CARES funding. We know we talked about the actual CARES packages that we kind of put together for these businesses when they're opening, the CARE package, but we got some CARES funding. And that was relief on behalf of the federal government that have identified certain counties throughout the country, municipalities, if you will, that have been impacted. And again, over 500,000 people, 500,000 people or more. There has been an amount of money that was given to them per capita, population based. And here in Macomb County, we got $152.5 million to figure out how do we want to anticipate the utilization of that. One of those areas that we're going to be working on is going to be the business sector, and we're going to be announcing it tomorrow. We're having a press conference here at our Comtech Center. Very minimal amount of participation on behalf of the media, less than 10 people. But with that being said, we're going to explain exactly how we plan on or anticipate using some of those funds, but more specifically what we're going to be doing with the business sector here.
Mark, this announcement came out with regards to the reward at the end of April. What our team has been doing is not only compiling what our organizational strategy is going to be with regards to this $152.5 million, but ensuring that it follows all the strict eligibility and compliance with the federal government. Our EOC has been coordinating with our finance department and also the county's independent auditor to say, how can we put together these programmatic pools of dollars? We have some initial projections that we're going to be getting out this week, and as we scale up these programs, it's going to give us a better opportunity not only to be nimble with these funds, but be and deploy those funds where the greatest community need is in this snapshot of time. So whether it's the next month, whether it's the next 2 months, whether it's the next 12 weeks, whatever it is, we can be nimble with these funds and get it to where the community needs it the most.
Yeah, we're going to caution the business folks as well as local municipalities. There's funding for that. And Macomb Community Action, trying to figure out how we deal with the vulnerable population, our health department, trying to make sure that we have the proper testing, and we're trying to get more testing, engaged in this process. Even our contact tracing, all of that stuff we're going to be doing, and emergency management with stockpiling PPE and getting them to the first responders. So there's a lot of money that we're going to be figuring out how do we dispense, and they're going to be putting in these pools. We're going to get information out, but we want to caution the local units of government and or businesses calling us too far in advance. We just try to get the plan out there. We'll have all the necessary steps somebody needs to go through to, I guess, if you will, apply for those type of funds. And these are grant funds that are going to be going to businesses and local municipalities, meaning they're not loans and they don't have to pay us back. These are funds that we're going to be able to give to them based upon certain criteria. We're setting up those parameters, so it may be the first part of June before we actually start having them, I guess, if you will, businesses applying for the funds. So what we don't want is people inundating us over the next week or two saying, how do I get the money? What do I need to do? We will have a secondary press conference for that announcement that we need you to go ahead and start sending in your request to figure out how they get access to some of those funds that we have available
Mark,
for them.
it's about preparation and coordination, getting a substantial pool of resources from the federal government to combat the impact of the coronavirus. We want to make sure that we're at least notifying folks of what's in the pipeline, what's coming down, how they can engage it. This initial announcement that you're going to be getting out this week will help let us prepare and coordinate with all those partners on the private and the public sector, and also with our internal partners to facilitate those dollars in the most efficient, responsible way to combat this in our community.
Yeah, and we're fortunate. I mean, the state got funding to help out local units of government. What we did as one of those counties of a large population, it was Wayne, Oakland, Macomb, obviously, and Kent County was another, as well as the city of Detroit. We got a separate pool of money for that. However, we are still going to try to figure out how do we use some of that to support some of the concerns that locals have as well. So with that, we can't thank our federal partners enough. Debbie Stabenow and obviously Gary Peters as well as our other legislators that are out there trying to figure out how do we how do we continue to deal with this? Mr. Mitchell, Paul Mitchell, and Andy Levin. They've been very supportive on this. We can't thank them for it. It's going to go to good use, and to try to figure out how do we support these various areas of concern that we have had. So, with that being said, again, tomorrow, what time is the actual press conference itself? Will we have it scheduled for?
We're going to be at 11 o'clock tomorrow morning.
11 o'clock. So 11 o'clock tomorrow, we're going to be doing that press conference, give a little bit more detail on that, so please stay tuned for that. In the meantime, we just want to thank you for joining us for this update here. Continue to monitor macombgov.org and get yourself updated on the latest and greatest of information that deals with this coronavirus concern that we have, as well as any other information you may need. So in the meantime, on behalf of JP and myself and the rest of us here in the county, continue to keep yourself and your family safe.